All right. Next up, gotta get the title right. So it is abdominal, hematologic, gynecologic, genitourinary, and renal emergencies. So let's start off with abdominal emergencies. What we get is abdominal emergencies can be complex. Reason being is that there's a lot of different possibilities. Lots of different possibilities. Now, I can speak for all the guys here. And don't contradict me, guys. You women are special. Right, guys?
Mm-hmm.
Got a couple of them saying yeah, so. Okay. The thing about abdominal emergencies with women of childbearing age, we got a lot of things to think about. Once they hit menopause, not so much, but before that, there's a lot of possibilities. We got to throw in possible pregnancy stuff in there. We know the quadrants. Actually, the more I think about it, I think he was just kind of joshing with me as far as the number he gave me. But I remember this buddy of mine, he's a doctor, he told me, you know how many different possibilities for abdominal pain there are for women of childbearing age? What do you think he told me?
49.
Nobody wants to give me a number?
49.
More than 39.
100.
More than 100. How about 10,000? It's a lot. Now, I don't think that is true, the more I think about it, but there's a lot of different possibilities. Okay. Our job is not necessarily to figure out what's going on. Our job is to take care of what we're presented with. Now, remember with the abdomen, we have the quadrants. I'm not going to go over the quadrants. You guys should know that. But we have organs. What are the two different types of organs we have in the abdomen?
Solid.
Solid
And hollow.
and hollow. How do we differentiate the two? What makes a solid organ a solid organ? What's the important thing to remember? It's going to come more into play when we talk about trauma. But what's the thing about solid organs? This is why I'm reviewing.
They're vascular.
They're very, very vascular. Yes. And what about hollow organs?
Contain substances.
Yeah. They're hollow. They collect things like fluids. Okay. So, what organs do we find in the right upper quadrant?
The gallbladder.
The what?
The gallbladder.
I can't hear you.
The gallbladder.
Okay, gallbladder, good.
Liver, colon, small intestine.
Pancreas.
Okay, so large and small intestine. I don't know if somebody said liver. Now, as far as the pancreas, it does start out in the right upper quadrant, right? But where's most of it at?
Right lower.
Nope,
Left upper.
the left upper. Left upper. Okay. What's in the left upper quadrant?
Pancreas.
Okay, the pancreas.
Spleen.
The rest of the pancreas.
Spleen.
The spleen,
Stomach.
stomach.
Colon.
Okay, large intestine,
Small intestine.
small intestine. What about the left lower quadrant?
Large intestine. Small intestine.
And that's about it. How about in the right lower quadrant?
Appendix.
The main one is the appendix, but you also have the large and small intestine. Okay. So abdominal pain by itself could be a lot of different things. What we're going to see with the patients, usually some sort of, or caused by some sort of stretching, some sort of inflammation, or even ischemia, like an ischemic bowel. Remember, ischemia is lack of oxygen flow to tissue. So something could be causing the bowel to become ischemic. It's interrupting blood flow to that part of the bowel. There's kind of two types of pain, actually three types of pain when it comes to abdominal pain. What are they? Or let me rephrase that. The first kind is visceral pain. What is it about visceral pain that differentiates it from the others?
Is it that
More
it's
of a
less?
dull ache directly over
Yeah.
the organ?
Mm-hmm.
Or actually, I take that back. More generalized, kind of all over. Um, it could be a constant pain. It could be an intermittent pain. It just kind of varies. Okay. What about parietal pain? Tell me about parietal pain.
So a lot worse and more local, or like in one area.
Yeah, more localized. You kind of feel it over the area. Now, not all abdominal organs have nerve endings, so you might not feel that pain directly over the organ. Sharp, constant pain. And the last type of pain is what?
Somatic pain.
Referred.
Referred pain. What is it about referred pain?
felt elsewhere.
Yep. So it's a type of visceral pain, but the thing about it, like I said, is because the nerve endings are not located in all organs, we might feel the pain somewhere other where the organ is. For example, when you have gallbladder issues, cholecystitis, or gallstones, you're not going to feel it in the front. You're actually going to feel it in the back underneath the shoulder blade. So that's referred pain. Liver pain, you can feel it in the left shoulder. Injury to the spleen, you also feel it in the left shoulder. Last time I checked, the liver and the spleen weren't over in the left shoulder. So that's referred pain. You'll feel it somewhere other than where the pain is originating from. Okay. So like I said, don't try to worry about what's causing the problem, because there's a lot of problems. Appendicitis, peritonitis, cholecystitis, pancreatitis. You notice a lot of itises? Gastroenteritis, gastritis. I just love that diagnosis in Spanish. It's like so generalized. You could have a AAA, abdominal aortic aneurysm. You could have a hernia. So what is peritonitis? First off, what is the peritoneum? There's tissue in the abdomen that encloses the organs, and are found throughout the abdominal cavity. And so when you have an infection of that lining, it causes peritonitis. Causes of peritonitis includes a burst appendix, burst intestine or bladder, because you have those substances that are leaking out, irritating the peritoneum, causing peritonitis. Because it's an inflammation and infection, what are some of the symptoms you're going to find?
Fever,
Nausea,
Nausea,
vomiting,
vomiting,
lack of appetite,
lack of appetite,
Chills.
chills. What's a Markle test? I think it's also called the heel drop test.
isn't that like palpitating the abdomen?
Palpating the abdomen? No.
can you repeat that question again? What is what?
The Markle test.
Markle?
Yeah. Like Meghan Markle?
Oh, it's what they use to identify appendicitis.
Okay. Give me more. How do you do it? Now you could also use this test to check for appendicitis.
Isn't it where they just go up like on a tippy toe and then drop onto their heels?
Exactly. Then stand up, get on their tippy toes, drop down to create a thud. If they have pain in the abdomen, that's a positive Markle test. And again, it's also used for appendicitis. Now, speaking of appendicitis, what is appendicitis?
When your appendix is inflamed?
There you go. Inflammation of the appendix. What causes that?
Blockage in the intestine.
No, that's an intestinal obstruction.
It's something when we're young, right?
No, it could happen when you're older. Things get put into the appendix. They say that, I mean, they really don't know what the appendix does. Some people say that, like for people that bite their nails, that I forget what the substance is that makes up fingernails, but is it keratin? Which I found out it's the same thing that creates the rattles on a rattlesnake. It's the same type of substance. That the fingernails go into the appendix. Who knows? But stuff can get in there. And eventually it will cause the appendix to swell. And if it's not taken care of, it will rupture, causing peritonitis. Because you got the substance that's in the appendix getting released into the peritoneum. So. It is more common in children, but it could also happen as adults. And so how do they take care of peritonitis?
They remove it.
Yep. How?
With big knives.
Not necessarily. No more. Yeah, it's surgery. What are the signs of appendicitis?
Fever,
Okay, fever,
chills,
Pain.
chills,
Abdominal pain,
abdominal pain. Where?
lower quadrant, lower right quadrant.
Right lower quadrant pain. You could also have what they call rebound tenderness. And you could do the Markle test. Rebound tenderness is not always a good indicator. I mean, it gives you an idea. But what do I mean with rebound tenderness?
When you press in and when you let go, it hurts.
Exactly. Rebound tenderness. Normal tenderness is you press down, ow, ow, ow. With rebound tenderness, you press in and you let go, then they say ow.
Why
The other
is
thing
that
that you'll
with
have
the
is
appendicitis?
periumbilical. Huh?
Why is that with the appendicitis? Why is it when you let go that it hurts?
Part of it is what's occurring. More than that, I will get back to you on that. It's a good question. They're saying because uh, it's going into the peritoneum. So that inflammation process has extended into the peritoneum, which is causing that rebound tenderness. They're not really getting away from that. It's just is what occurs when you have the peritoneum involved. Okay, one thing about peritonitis or abdominal pain, we talked about palpating. When you palpate the abdomen, remember I showed you guys how you roll your hand over the abdomen? Just kind of pressing, like that's not going to do the job. You got to be there. You got to roll the hand. I'm doing my shoulder because you can see it. Actually, it's not bothering me right now. Huh. And my shoulder feels pretty good. I think it's the meloxicam. Anyway. You roll the hand over the quadrants. Number two, first ask them where's the pain located. So you could do that quadrant last. So you want to make sure it's nowhere else but where they're complaining of the pain. Okay. All right. Did that explain your question, Ms. Candace?
Yes.
Okay. So it just causes it, indicative of infection in the peritoneum. So another type of emergency we have is pancreatitis, inflammation of the pancreas. The pain, they'll have tenderness, they'll have distension of the abdomen, and that pain can radiate down to the umbilicus and even to the back. Have a fever, signs of shock. It can get pretty bad. Another type of emergency we have is cholecystitis, also known as gallstones. I wouldn't say primarily, but it is more common in women, especially women 30 to 50 years of age. Now, something you have to remember is, what does the gallbladder do? And why? This is important to be able to understand cholecystitis.
Doesn't it help break down your food?
What kind of food? You're right, but what kind of food primarily?
Fatty foods?
There you go. The gallbladder stores bile. It releases bile into the liver, and the liver helps break down fats using the bile. So if you have gallstones, what is it? Or it's blocking the release of what? Of bile. So are those fats getting processed? And therefore, what happens with cholecystitis is they'll have an episode, shall we say, of cholecystitis after eating a fatty meal. Because the body's unable to release enough bile to break down those fats. So again, it's more common in women, and you'll see an exacerbation of cholecystitis after eating a fatty meal. That pain, you can't find it in the upper middle or upper right quadrant, but more likely you'll find it underneath the right shoulder blade. When it comes to the GI tract, it starts at the mouth and it ends at the rectum or the anus. When we're talking about GI bleeding, and again, that's the whole tract, starting from the mouth going all the way down. A couple of things are important to look for. If I'm coughing up blood, and that blood is bright red, number one, where is it coming from? And two, why is it bright red? Put your thinking caps on. Any of you guys enjoy Everclear or Rum 151? Steve, you do?
Not
Where you are
anymore,
between
but
40s and 70s, so you could have these issues.
I did before, not anymore.
What, the coughing up blood?
Oh, no, not that. Just enjoying the 151.
Oh, okay. What's causing that blood coming out is what we call esophageal varices. They're upper GI hemorrhoids, really. And so as they're coughing, it's because the blood that's leaking out is irritating. And so as we cough, well, that's coming from the lungs, but it's coming out bright red because it's coming directly from the veins or the blood vessels in the esophagus. Now, the other thing too is that it hasn't gone down to the stomach. In other words, the stomach acids have not processed that blood. So that's why it's bright red. If it has been processed by the stomach, then it's going to come out dark red. And it even looks like what they call coffee ground. In that case, the person is going to vomit. Okay? They're going to vomit. What's the medical term for coughing up blood?
Hematemesis?
What was that?
Hematemesis? Something.
No.
No.
Hematemesis is vomiting up blood. Hemoptysis. Hemoptysis. That's coughing up blood. Hematemesis, look at the emesis, is vomiting blood. Okay. Now, let's go to the lower part of the GI tract. So you go to the bathroom, and man, you just strained yourself to go poop. So you wipe your little tush, and you notice there's some bright red blood in the toilet paper. Why is that?
You said bright?
Yep.
That'd be bleeding from your small intestine, no?
Nope.
Then your actual booty? Or anus?
Not the anus, unless you like to put stuff up there or through there.
That was just prison, sir.
This is only the one time, right? And they left you alone after that?
Should it be from hemorrhoids?
What was that?
Hemorrhoids?
Hemorrhoids. Good. Hemorrhoids. What are hemorrhoids? Besides a pain in the ass. They're inflamed blood vessels. And you notice I said you're really, what was it? You really strained yourself to go to the bathroom? You're pushing and pushing? Well, that's a bad thing because it increases the size of the blood vessels in the rectum. And they can burst, causing hemorrhoids. So hemorrhoids are swollen blood vessels in the rectum. And so when they're bleeding, it's because you've ruptured a couple of those vessels. Now, just like we did at the top, the same thing at the bottom. So if it's bright red blood, it's probably coming from the rectum. Not a big deal. However, if they go number 2 and it's dark red, and that's where we get into the hematochezia, that is in the digestive tract itself, somewhere in the intestines. Because remember what happened with the hematemesis, how it was dark red, looking like coffee grounds? And another term for it is coffee ground emesis. But what happened here is that it's been processed by the GI tract. So when it comes out, it got processed, got absorbed. So again, it is dark red. Now, what might we see signs and symptoms of? And why? Come on, guys, wake up. You guys have 3 weeks with me, and then you're off for 2 weeks. And then it's the home stretch. All of January and part of February. So we're about 2.5 months away from finishing. All of December, all of January, and the first 2 weeks of February. I see the light at the end of the tunnel. Think about it, guys. What is this person doing? And don't say going poop. Remember, there's good news and bad news about it.
They're straining.
What was that?
They're straining.
No,
They're bleeding.
So they're
Bleeding.
pushing hard.
bleeding. And so as a result of that bleeding, that's the why. What do you need to be on the lookout for as a result of that bleeding?
Shock.
Shock. Shock. Look for signs of shock. Pale, clammy skin, tachycardia, tachypnea, lethargy, weakness. Okay, so think about shock. For a lot of these things, there's not a lot of treatment we do. Abdominal pain is very simple. They have abdominal pain. Find out where it's at. Do your assessment. Think about what could be going on. A lot of the treatment is position of comfort, which for abdominal pain, a lot of times it's going to be where they're laying on their side, with their knees drawn up. We call that the fetal position. Maybe give them O2 if it's indicated, and transport. One big thing about abdominal pain is you never give them anything to eat or drink. Nothing by mouth. NPO. Because they may be going into surgery. So nothing to eat or drink. What's an ulcer? What is an ulcer?
Sores in the stomach, no?
No, not sores.
Isn't it a hole?
Holes in the stomach. Our stomach lining is pretty tough because there's hydrochloric acid? It's a really strong acid. It's how the foods get broken down. But our stomach lining can handle that acidic environment. But if you're constantly aggravated, high stress, the acid reflux builds up and eventually can cause or create a hole within your stomach lining. So abdominal pain. I guess the book does talk about sores, open sores in the stomach. They're more open holes. Now, the bad thing about those openings or those sores is they can bleed. So you heard somebody talking about they have bleeding ulcers.
Mm-hmm.
So might they vomit up dark red blood, hematemesis? Yes, they might. Yes, they might. You could also have intestinal obstructions caused by a tumor, caused by a torsion, which the abdomen twists. The other thing too is the technical name is fecal impaction, constipation. Usually constipation is caused by dehydration because the bowels are nice and moist and they slide through. And if you're dehydrated, it takes out fluid and it gets stuck. That's why when you go number 2 and it like burns as it's coming out, it's kind of dry and it's stretching the stuff. It's not coming out nice and easy. I know it sounds weird talking about poop, but we're in the medical field, so it's nothing. You should hear some of the conversations I've had over the years while eating. We don't care. It's normal for us. An intestinal obstruction left untreated can cause an infection. Or it can cause intestinal infarction. In other words, remember that ischemic bowel? Enough of the bowel became ischemic till eventually it infarted. The bowel died. So they'll have to go in there and cut out that dead bowel. And then what will they need for a while? The colostomy bag. You ever changed out a colostomy bag? What is a colostomy?
It's a bag that holds the poop.
Fecal matter.
Yeah.
Oh, yeah, it's a hole in the colon. They put a bag over that opening, so as that fecal matter is traveling through the intestine, wherever the colostomy is, that fecal matter is going to get emptied into that bag, the colostomy bag. The thing about those bags is it's an adhesive that's holding it over that opening, so sometimes those things become loose. And you want to talk about a gnarly smell? Another gnarly smell is rectal bleeding. Oh my gosh, that's something else.
When you have a GI bleed and then you're bleeding out rectally, that's the worst.
Yeah. Yep. I had a patient. He unfortunately died. We didn't catch this, and I feel really bad that he ended up dying. But he was so far gone. we took him to the hospital. Somebody called. They thought he was having a heart attack, and he wasn't. My partner thought he might be having a CVA. I checked him for it. He wasn't having a CVA. But he was a poor historian, and we couldn't get good vitals because of movement in the ambulance. And again, he couldn't really tell us a lot. We get him to the hospital. We put him on the bed, and I forget to have a cigarette or to start my paperwork. And somewhere along the way in the hospital, he had a bowel movement. We'll just keep it clean. He had a bowel movement. Well, it was a GI bleed. It smelled horrible. And I had two of my students, they were paramedic students of mine that worked there at Del Sol. So I thought it was an interesting case, and I called one of my students, and I'm like, follow me. And he's like, are you taking me to that guy back in room so-and-so? I'm like, yeah. He's like, oh, no. I'm like, okay, that's weird. And then he tells me, and as I'm walking over there, I'm still like a good 50, 60 feet away. That smell just hit me. Then I had another student there too. And he's like, Blue, we hate you. They ended up doing a CAT scan, and he did have major GI bleeding. I think he had an aneurysm. They put him in ICU, and he died 3 days later. He just lost so much blood. Working industrial medicine, and because of my last job, we used to get a couple of these. What can cause a hernia?
Heavy lifting.
Heavy lifting, straining while you lift. Yep. What's happening with a hernia? Ernesto, what's on your forehead? Poker chip.
Yes, sir.
Is there a reason why you have a poker chip on your forehead?
It's on my nightstand, and sometimes I just mess around with it. My bad.
Oh, okay. No worries. I just like, does he have something on his forehead?
He was watching the Avengers.
What does it have to do with a poker chip on his forehead?
You have to watch the movie.
I have seen it. I don't remember a poker chip on a forehead.
It wasn't a poker chip. It was something else, some kind of rock or ruby or something.
Oh, that's like infinity work?
The Infinity Stones?
Yeah, those things.
Look at Paula. She knows her Avengers. She knows the Marvel Universe. Anyway, so what's happening in a hernia?
Isn't it like a hole? I can't remember what it is, but both of my kids were born with one. But my daughter's closed, my son's is still open.
Yeah, a hernia is where you have a hole in the abdominal wall, and part of the bowel, usually the small intestine, goes through that opening. The danger of that is having a strangulated hernia or a strangulated bowel, because it could be a small opening and part of the intestine is there. Well, it's not getting blood flow. So now you have an ischemic bowel as a result of that. Okay. Yeah, ultimately they'll need surgery, right?
Yeah, this pediatrician said that they wait till after they turn 1, because then they start walking, and they see if the muscles in the stomach will go strong enough to go ahead and close it. Like my daughter's, as soon as she started crawling, hers closed up. But my son, he's walking, running, and everything, and his still isn't. His hasn't closed yet, so he was like, well, at his 2-year appointment, which is coming up, he said he'll take a look at it again and see what steps they need to take from there.
Yeah. Yeah, they usually put a mesh to prevent it from going through again. So let's go back to our patient assessment, and we're palpating the abdomen. What are we looking for as we palpate the abdomen?
Rebound
Tenderness.
Okay, tenderness, rebound tenderness. What else?
Distension.
Okay, we're looking for abdominal distension. What else? I know I mentioned this to you guys.
A rigid abdomen, like tightening.
Okay, what does that usually cause from?
Internal bleeding.
Internal bleeding. Yep. What else are we looking for? I know I told you guys. A pulsatile mass. What does that indicate? Anybody have any ideas? Any guesses?
An obstruction.
Nope.
I don't know. I was gonna say obstruction or blockage.
Nope.
Could it be the aneurysm that we were talking about?
There you go. Pulsatile.
What did you call it
Pulsatile.
again?
Pulsatile mass.
Pulsatile mass.
Yeah. We'll feel a mass in the abdomen, but it's also pulsating. And that's because with every heartbeat. And so if you see it getting bigger, we're bleeding out into the abdominal cavity. Not a good thing. When it happens in the abdomen, we call that a AAA, an abdominal aortic aneurysm. Remember, an aneurysm is an abnormal ballooning of an artery. And as that pressure builds up, it balloons the artery, the abdominal aorta, till eventually it can rupture, just like a balloon. The most exciting AAA I ever had, we took her to a hospital. We actually took her, I was working in LA. We actually took her to Cedars-Sinai Medical Center. I don't know if you guys have ever heard of Cedars-Sinai, but a lot of movie stars go there, and a lot of singers go there. So it's a very well-known hospital in LA. It's very fancy. So it's the first time going there, so I'm kind of like, I wonder if I'm going to see any famous people here. So we get to the ER, they're like, nope, you're going upstairs. Surgical floor. I'm like, okay. So we get up there, and I'm looking to drop her off in like pre-op so they can get her ready and everything. I'm like, you're going in here. So we go in there, I look around, it's a freaking operating room. We literally plopped her down on that OR table. Like, damn, this lady's bad. So they had to go in there and repair it because she was bleeding out from an aneurysm. So I had to go in there and repair it. And kind of what they do is, you've seen like submarine movies where they start taking on water and they put those I don't know what you call them, brackets that enclose the tube.
They seal it or sleeve it.
Yeah, there you go. That's kind of what they do to aneurysms. They put that on the outside to keep it small. I mean, if there's any leakage, they'll suture that up, but then they'll put that sleeve on it. So, as we get older, the higher incidence of suffering from a AAA. Remember, the arteries start getting hard and the blood pressure gets elevated, which it does, then we're going to have those issues. Now, another term with AAAs is what we call an aortic dissection. What do they mean with our aortic dissection?
Is that when it starts to build collaterals?
Nope.
Or is it when it gets bigger and it starts to get travel?
No. What happens is, and you don't really need to know it for this class, but just so you know, arteries are made of 3 layers. They call them tunics, tunica, meaning a tunic. The innermost layer, which you see in here, you got the blood going through, and this yellow layer, that's called the tunica intima, the innermost layer. The tunica media and the tunica externa. So 3 layers. So what happens in an aortic dissection is you notice how you have a break in that tunica or that tunic, that tunica intima. So blood is leaking into the next area. What can happen eventually because of that buildup in pressure is it's going to weaken this next layer until it starts leaking to the next layer. And again, you have enough pressure build up, it will rupture. Now you have an aneurysm. Well, you build up the aneurysm, now you got a bleeding aneurysm. Okay? So that's what an aortic dissection is. It's just a leaking of blood into the next layer until eventually it ruptures. All right. Ow. Now, the thing about aneurysms or AAAs is you'll have pain in the abdomen, but typically, because remember, we want to use OPQRST for abdominal pain. And so when you're doing the OPQRST, you ask them radiation, or yeah, we'll do radiation first. No, take that back. We'll do quality. Quality, they describe it as a knife going right through them. In radiation, it's going right through to them to the back, from the abdomen to the back. So those are typical signs or symptoms of a AAA. Once it's bleeding, like a knife is cutting right through them, and it is going straight through to the back. They might even describe it as a tearing pain. So we have bleeding. So again, what kind of signs and symptoms might we find? Shock, Shock. Once you find that pulsating mass, stop palpating the abdomen. We don't want to push more blood out of that aorta. So really, we need to take him to the hospital. One thing about elderly patients and abdominal pain is that because of the decreased pain perception, they might not be able to describe it very well, or they might not even feel a lot of pain. So as a result, especially Hispanic males being very stubborn, I don't know, get better. I'll take some Pepto, it's going to get better. No. So remember I mentioned at the start of medical emergencies how you have to be a detective when it comes to medical emergencies. Here with abdominal pain, it is more of a challenge investigating what's going on. You guys got that handout I sent to you like last week before? You read that case, the child complaining of abdominal pain. What do you think that child had? You guys didn't read my handout? No. At least you're honest. Thank you, Jesse. Anybody read it? No. Okay. You need to ask your OPQRST questions. If you have a female of childbearing age, really the question is, the first one is, what was the date of your last menstrual cycle? If it's been more than a month, you might ask them, are you regular or irregular? Because some women have irregular periods. Some of them don't. Some of them are because they take birth control, so they don't always get their periods. Some of them are just strange. Just kidding. Something is causing it, but if it's been more than a month, again, ask them if they're regular or irregular. And the next question you have to ask, and you got to be very careful with this question, you want to find out if there's a possibility they could be pregnant. The best way to ask is exactly how I said it. Is there a possibility you could be pregnant? You're asking them if they're having sex, but you're not asking them, all right, are you having sex? It's just, is there a possibility you could be pregnant? Okay. If they say no, okay. So you want to rule out pregnancy first with women of childbearing age complaining of abdominal pain, because it could be an ectopic pregnancy, it could be, excuse me, they could be having a miscarriage, and if they're not pregnant, it could be that they have endometriosis, endometritis, something going on. Okay. Other things to find out, to ask. Sorry. Any change in your appetite? Any problems going to the bathroom? Number 1 or number 2? If you have a woman complaining of right upper quadrant pain or pain underneath the right shoulder, have you eaten a fatty meal? Remember, you want to look at the quadrant. Now, we were talking about hernias, and Rakisha was mentioning about her daughter. One of the signs, especially in small kids, one of the signs of a hernia is that belly button is really an outie. It really bulges out that that belly button. So you want to visualize it. Again, what you might find the patient doing is in that fetal position. Another thing you might find is what we call guarding. In other words, they're guarding or protecting their stomach because it hurts so much. So if we lay them on the gurney, usually we'll put them in what we call the, well, it's called the fetal position, because the most comfortable position for them is in that knees drawn up to the chest, that fetal position, okay? Other than that, there's not a lot of stuff to do with abdominal pain. Another type of emergency we have is what we call hematologic emergencies. In other words, there's something with the blood. Anemia is one of those. Anemia is just low iron levels. It usually happens to women, especially pregnant women. Okay. They'll feel run down. They might be pale. And that's because they're not transporting enough oxygen throughout their bodies. So, let me talk about hemophilia real quick, and then I'll get into sickle cell. So hemophilia is a hereditary disorder of the blood that causes the person to not be able to clot. When we get cut or when we're bleeding from somewhere, we know that the body is going to do what it can to take care of itself. And this is one of those things that it's going to do to take care of itself. We call that hemostasis. Not homeostasis, hemostasis. Hemo meaning blood. And it's a cascading, it's called the clotting cascade. Now, one of the substances in there, it's a factor, and I believe it's factor 12 or 13, that involves blood clotting. Or, no, not blood clotting. It's creating the clot. Without that factor, the clotting doesn't occur. So they'll keep bleeding and bleeding and bleeding. Nowadays, they have medicines that they can inject themselves with if they start to bleed to help create that clot. Before they didn't. What they did was, and they still do, but not as often, was they gave them a blood transfusion. Unfortunately, back in the 80s, a lot of hemophiliacs died. Why?
Not enough blood.
What was that?
There wasn't enough blood to go around.
Nope, that's not it.
They were administering the wrong blood type.
Nope.
They caught a disease or something like that.
What was that, Rakisha?
Caught something from the blood.
Yeah, what is that something?
AIDS or HIV.
AIDS. you guys, AIDS has always been around. You've never known a time without AIDS. AIDS came about in about 81, 82. I was 9, 10 years old then. So I lived in a world without AIDS. Well, before they really knew what was going on, they weren't testing blood for things like AIDS. And so people would give blood transfusion and they had AIDS. Well, they gave it to the recipient of that donor blood. So a lot of hemophiliacs, because like I said, blood transfusion, guess what happened? They got AIDS as a result of that blood transfusion. So a lot of them died. Again, it's a hereditary disease. Trying to fix my little lamp here. It was my dad's lamp. So yeah, that they killed off a lot of hemophiliacs. Remember I talked about Ryan White? Or did I talk about Ryan White? No. Ryan White was a teenager back in the 80s. And he was a hemophiliac. He got a blood transfusion. As a result of a blood transfusion, he got AIDS. Well, he became HIV positive, eventually developed AIDS. Like I said, at the beginning, they didn't know much about AIDS. At first, it was a gay man's disease because it was being transmitted by homosexual contact. Now it's not even that anymore. But back in the early days, kind of like COVID was at the beginning, it was like a death sentence if you got COVID. Nowadays, it's like, a lot of people are okay with it. But back then, you might be expected to live about a year. So people were afraid of this virus. And what ended up happening was the high school he was going to, his classmates didn't want to be around him because he had AIDS. Oh, scary stuff. We don't want it out. Okay. Oh, crap. There's that pain. They didn't want to be around him. And so he had to drop out of school and he got homeschooled. Well, his story was spread and some superstars, some A-list celebrities befriended him. Elizabeth Taylor, Michael Jackson, Elton John. He ended up dying as a result of the AIDS virus. It is because of him we have the Ryan White Care Act. So that's a little background on Ryan White. He got AIDS as a result of a blood transfusion because he had hemophilia. But because he was a teenager, it gave AIDS a different face. Because again, before that, it was a gay man's disease. But that proved that anybody can get AIDS. So it kind of changed the narrative on it. Anyway, so that's what hemophilia is. It's a hereditary disorder that prevents clotting from occurring because they're missing a clotting factor. Now, another blood issue that we have is sickle cell anemia. Are you guys familiar with a sickle? They use it to cut wheat. It's a knife that's curved, like the sickle and hammer from the old Russian flag. So it's a type of knife. Well, you have the red blood cells that that take that sickle shape. So they're not round. And so what happens is, and red blood cells, they die off. Their average lifespan is about 3 months. Actually, it's a lot quicker, but within 3 months, all the red blood cells are new again. So it takes about 3 months. What happens is you get to a juncture in a blood vessel where it bifurcates, it divides into two. Well, that sickle cell, that red blood cell, kind of gets stuck up or gets stuck. So as blood is flowing, it backs up because that sickle cell is preventing good blood flow. And that's what we call a sickle cell crisis. They could have chest pain, abdominal pain, bone and joint pain, because the tissue's not getting enough oxygen. Because number one, the sickle cells don't carry a lot of oxygen, the normal 4. And 2, it's blocking blood flow, so again, it's reducing the amount of blood getting to parts of the body. As a result of that, a person could die. Now, number one, the most, or the races, or there's one predominant race. The others are kind of secondary. I haven't heard too many of those, but sickle cell anemia primarily affects African Americans, and more so African American men. The sad thing about sickle cell is that those individuals only live to be about 40 or 50. Not much longer after that. They say it also affects people of Mediterranean descent, and also Central and South Americans and the Middle East. But again, we hear it more with African American males. So for signs and symptoms of sickle cell anemia, think about the signs and symptoms of lack of blood flow, or really delivery of oxygen to the cells. Not much we could do. Oxygen. We mentioned women. Mickey's already telling me good night. Jeez, Mickey. As I mentioned, women can be challenging. A lot of different problems when it comes to abdominal pain in women. Like I said, pregnant, possibility of being pregnant. It could be a result of pregnancy. It could be a result of sexual abuse. It could be an abnormal menstrual cycle. It could be endometritis, endometriosis, PID. A lot of different things. UTI. That's why it's advisable that women clean after intercourse, because the urethra is smaller, so bacteria can get up into the urethra and cause a UTI. Sexual assault's more of a traumatic event. But the main thing about it, let's see, talks about Genital rectal bleeding, injuries, tears, STDs. Women will feel depressed, anxious. They might feel guilt. They might have a form of PTSD as a result of it as well. I'm a female. My name's Joni, and I was just sexually assaulted. So what are you going to be telling me? What are you going to do for me when you respond out to me, Joni, reporting a sexual assault?
We're gonna try
Come
to
on,
get
do your job.
right
Just
help.
go away. Nobody cares about me. What? I'm just gonna go kill myself. Nobody cares. And next thing you know, Joni commits suicide because nobody cared to ask her or to talk to her. Come on, this is a participation class. I should just record. You know what? I'm just gonna send you the videos that I've put up from other classes. Come on, participate.
Reassure her that you're there to help.
Okay. What else? How are you gonna help?
Just comfort her.
Okay.
Be there for her so she let her know she can talk to you.
Before we go, can I take a shower? I feel really dirty.
No, you can't do that right now.
You can't.
Why not?
Because you wash away evidence.
And I'd be washing away evidence. Okay. What else?
You're probably going to want to convince her to see if she can get to the hospital so she can get a SANE examination.
Yep.
You want to make sure you notify the hospital.
Okay. Now,
Police?
what?
The police, we need to notify them as well.
Notify who?
Police?
Yeah. They get the report of a sexual assault. Yeah, they're going to be dispatched automatically. So as Joni, I was just sexually assaulted by a dude. Do I want somebody like Gabe coming and talking to me? Oh, hell no. Men are dogs. No? Yeah. At least I see Keisha smiling. Yeah, whenever possible, try to have another female there. If it's not possible, just be very delicate with what you ask and say. Be careful about touching evidence, disturbing any evidence. The other thing too is, and the first ambulance company I worked for, we carried paper bags in the trucks. But all the other companies I've worked for over the years, even in the fire department, we didn't have paper bags. Why do we want to use a paper bag?
because a plastic bag could damage the evidence.
Yeah. The paper bags breathe better. Plastic bags, not so much. It could destroy the evidence, as Ray said. It's great having a cop's perspective, isn't it? Thank you for sharing. Be non-judgmental. Provide a safe environment for them. Respect their confidentiality and their modesty. Remember, they've just been through a traumatic event. Now, I know we're talking about women, but can men be sexually assaulted? Yeah.
Yes.
Yeah. I talked about an abnormal period. A woman can have non-traumatic bleeding. They could have traumatic bleeding, but also non-traumatic bleeding. Very, very, very heavy flow. I was working at a clinic here before I became an EMT, and this lady came in. She had a lot of vaginal bleeding. It was just an abnormal period, but she kept bleeding and bleeding and bleeding, and the doctors were in there trying to stop it and everything else. They couldn't. So they called 911. AMR came in, picked her up, found out that she had a radical hysterectomy. In order to get her to stop bleeding, they took out her uterus. It was pretty severe bleeding. Another thing that can cause bleeding is a spontaneous abortion. As the body's trying to get rid of the products of the pregnancy, bleeding is occurring. So, then I had another young lady. She also had significant vaginal bleeding, and she was hypovolemic. This one happened when I was in paramedic school, and so she needed an IV. Unfortunately, dehydrated and hypovolemic patients, they tend to have very poor veins. So my preceptor's like, "Hey, go ahead and do an EJ." I was like, "No, come on, no." And so he's like, "All right, just remember, teach one, do one." Because I hadn't learned how to do it in school. Well, no, I did, but I never practiced it. And so he did it, put that needle in her neck, and gave her fluid. Fortunately, I never had another instance where I needed to do an EJ. So, but we gave her fluid that way. It can cause shock, hypovolemic shock, from all that bleeding. So you'll see the signs and symptoms of shock. What's the medical term for difficulty or a painful menstrual cycle? Dysmenorrhea. Painful menstruation. Just they're bitchier and more in pain during their period. Yes to the pain or yes to the bitchiness? Both. At least they're honest. I might have had one case in my career. I haven't seen a lot of these. Hospitals get them all the time. And that's PID, pelvic inflammatory disease. It's basically an infection of the female reproductive tract. This could be caused from an STD. This could be caused by being a lady of the night or partaking a little bit too much in the adult happy time. what I've seen kids around, so I got to make it like PG. Patient will have abdominal pain, tenderness. They might have abdominal vaginal discharge. They might have experienced pain during intercourse or during adult happy time. There might be a foul smell to that area, the vaginal area. What's that? I was going to say about PID. Oh, their gait. They kind of just, how can I describe it? They shuffle along. They do what they call the PID shuffle. Because of the infection and it hurts for them to walk, they walk funny. So again, the PID shuffle. Because of this process. So you need to ask questions. Now, here's an example of an abdominal pain patient, and I might have told you before, maybe not, that I thought it was one thing and it ended up being another. Get called out to a private residence, mobile home park, for a 20-year-old female, 19 or 20-year-old female, complaining of abdominal pain. Okay. Hi, ma'am. What's going on? Stomach hurts? All right. What did I tell you about abdominal pain in women of childbearing age?
Possible pregnancy.
We got to think about possible pregnancy. So, how am I going to determine whether she might be pregnant or not?
Ask when her last menstrual date was.
Okay. Then what else?
Ask if it's possible she's pregnant.
Is there a possibility you could be pregnant? She says yes. Oh, the answer to the last menstrual cycle was about 2 months ago. When you ask her a possibility of being pregnant, she says yes. So what are you thinking so far? Besides women are difficult. Anything? Any ideas? Huh?
Ectopic pregnancy.
What was that?
Ectopic.
Okay, possible ectopic pregnancy. Good. That's what I was thinking. And this young lady had abdominal pain. Okay. So she wants to go to the hospital. I start an IV. Take her to the hospital. The abdominal pain I was telling you about, it wasn't constant. It was intermittent. Okay. Get into the ER. I'm giving my report and I tell the nurse about that pain. As soon as I told her about that pain, here's this girl that starts screaming because of the pain. So the nurse goes up to her, palpates her abdomen, turns around and says, she's in labor. Wait, what? Oh, by the way, she had like an 18-month-old kid already. Pregnant? Well, yeah, but she's having an ectopic pregnancy. What you talking about, Willis? Saying that she's pregnant. She's in labor. we left. We came back a few hours later. The nurse says, "Remember that girl you brought in? She gave birth to a baby boy, full-term baby boy." Talk about throwing a curveball. At first, like the mom's like, "No, I don't think she's pregnant." Then afterwards, she's like, "Yeah, I knew she was pregnant." It's like, what the flock? Turned out okay, but we'll talk more about it when we do OB. But it was interesting. It was very interesting. So ask some questions, do your vital signs, palpate, trying to get an idea of what's going on. Again, remember you want to check OPQRST with abdominal pain. All right. Oh, shoot. Thought we had more time. All right. It's after 10 o'clock. Do read up on the rest of the abdominal emergencies.